Psychetruth. Life, wisdom.
Hi everybody, this is Gregory Gorey with Bodywork Masters, and today we're working with Joy, who is a gymnast and recently had a hip injury, well, hip leg, and she's got a limited range of motion through her left IT band. So what we're going to do first is get a sense of the difference. We're going to try to isolate where the pain is, and then we're going to do some techniques to open up the hips and lower leg, and hopefully we'll see a difference in her range of motion. So let's have you scoot forward, and then let's have you go to the side that's not injured first and take a look at that range of motion. So she's got her chin to her knee, so she's got plenty of range of motion there. Good. And now let's come back to the other side and see what that looks like. And that is a significant difference. So tell me, where are you feeling that when you go into that position? Into the glute right there. Okay. So what we're going to do is we're going to release all of these structures. We're going to release her quadriceps. We're going to release her hamstrings. And then we're also going to get in and try to create some space between her IT band and quads and hamstrings. The IT band can become adhered to it. Like we want it to be adhered to it, obviously, in the way that, you know, it's attached. But what can happen is the fascial bags there can start to adhere in places that we don't want them to adhere, and the muscles start having a hard time sliding off of each other. So we're going to try to create some space between the IT band and her quadriceps and her hamstrings. So let's go ahead and have you start laying on your back, please. Alright, so we determined that there's a significant range of motion difference. So I'm going to try to get all of these structures. We're going to get the quadriceps, we're going to get the hamstrings, we're going to get the IT band, possibly work up into the tensor fasciae lata here, and the medius and the max as it comes down and merges with the IT band. So the first thing we're going to do is just some flat pressure for the quadriceps and just get some blood into them. There's nothing terribly complicated. I'm just coming down. I'm not pushing with my arms. My legs or my arms are kind of locked out, and I'm just letting my body weight drop into her. We can also come to the edge of the IT band and just kind of pull it off, creating some space. Okay, not too much. Is that ticklish or tender? So we did some flat pressure, now we're actually going to, she's a little ticklish. So once again, we're just coming in, grabbing onto the quadriceps and lifting and separating off from the muscles underneath. Alright, now I also notice as we're here that her leg is wanting to drop out, that there's a big external rotation there, and we're going to do something that's called a log roll. I learned this in one of Eric Dalton's myoskeletal alignment technique seminars. If you ever get a chance, they're great, go check them out. But what we're going to do is we're going to try to stretch this tissue out and see if we can't get a little stretch into the hips and balance this out. So I'm going to kneel down. I'm going to take my bottom hand and I'm going to place it under her hand here, and then I'm going to lock into the tissue with this bottom hand. My top hand is coming right to the edge of the QL, or not to the QL, to the IT band, and then I'm going to gently rotate there. Now, Joy, what I'd like you to do is with 20% of your effort, gently roll your leg out into my hands. So you're going to roll your leg that way, and go for it. Roll, roll, roll. And count of 8 and relax, and then a deeper stretch. Where are you feeling that when I do that? Right where I'm at, or is it in your low back?
Right where it's at.
Okay. And so we were here, moving up a little bit. Do the same thing, going to roll out 20%. Count of 8 and relax. And deeper into the stretch. And one more. Coming up into the inner thigh, top hand is here, and rotate out. And relax, and deeper. Good. Also, while I have her here, I'm going to release her tensor fasciae lata. The tensor fasciae lata comes right on the inside of your hip, your ASIS right here, or your hip pointer. So right there's the TFL. She's squirming a little bit. Is that tender right there? That's a tickle pressure again. Okay. So coming there, and we can just lock into the tissue and there we go. And that feels like it's tender. Is that tender?
Yeah.
Yeah, I can. There's a density right there. So as you're doing this, you've got to, she was jumping at first, and I checked in with her, and she said it was ticklish. But as I moved down, I felt a difference in the tissue, and she reacted. But I could tell that one was a tickle and one was a spot that wasn't happy. So this is kind of right into the area where it stops being muscle and merges into the fascia of the IT band. So we're gonna get in and feeling for that density in the tissue that I was feeling before, and I'm just adding a little bit of motion with the rocking hand here. Is that starting to get less tender, or is it real intense? Okay, good. And that spot right there, yeah. So a lot of this is technique, but as a therapist, you have to start developing your sense of touch and differentiating. This tissue, an inch lower feels completely different. As far as the hardness and the density of the one before. And if you can't feel a difference, you should also be watching your clients. Are they reacting? Are they flinching? Are they wincing? Those are all signs that there's some discomfort. And it's important to check in with when you're doing therapeutic work, I never want somebody to feel like, they're in a lot of pain and they just want to jump off of the table. But some discomfort is okay. Some discomfort is an indicator that, no, that's actually a place that we need to work. As long as we're working, her nervous system is calming down. If I'm pressing on this tissue and I've been working on it for a minute, and I ask, is it getting better? And she says, no, it's staying the same, or even worse, it's getting worse. Then you need to come off of it, go someplace else, and then come back to the tender area that wasn't calming down with less force. But her nervous system is actually accepting this and starting to settle down. Alright, so from there, we're going to get into the hamstrings and pull them off the IT band, and then we'll get into the glutes and do a little cupping as well. Alright, so let's have you go ahead and turn over, please. Alright, so we just released the quadriceps and a little of the TFL. Now we're going to release the hamstrings and its attachments onto the IT band, and then we're going to work the medius and the max. So it's what I like to do with the hamstrings, kind of similar to what we were just doing on the other side. We're going to start with a little flat pressure. Going to work it all the way up into its insertion at the ischial tuberosity. Is that tender at all, or is that okay? A little tender. Okay. Shorten the muscle. Yeah, and now I'm feeling a little ropey cord right there. Yeah, and she can feel it. So actually, we're going to do a little light cross fiber friction on that insertion tendon. So this is light cross fiber friction. And then after we've done that for 30 seconds a minute, we can get in with deep cross fiber friction and follow it down a little bit. Does that feel like the area that you were pointing to your IT band before when you were bent over? But this is the spot. You were feeling it on the outside, but this is where you feel. You can also do a little hold, pin and stretch. So I'm locking down into the hamstrings. Then I'm lengthening the tissue underneath my fist. And just like with the quadricep, we can take it and just lift it up and off. From there, just like it within the quadricep, we want to pull the IT band off of the hamstring. So what I can do is take my hand, feel for the edge. You'll feel kind of like a ropey cord there. That's your IT band. I'm going to lock into that tissue, and then I'm going to stretch this away. So this is locked. I'm rotating the femur underneath my hand. From there, we're going to get into glute medius and glute max because they can cause tightness in the IT band because they all insert together. So what we're going to do is we're going to shorten these glute muscles by taking her into what I call a little frog leg. So we're going to take the knee, we're going to bring it all the way up. It's going to shorten all of this tissue. And then I'm going to come along the edge of the sacrum, looking for tender, tight spots right there. This is a little tender. I can hear her breathing as she tries to stay relaxed in this, but right there. That's a little spasmodic glute medius. You feel that little ropey cord? And she's saying that's the spot. I don't know if the mic picked it up. And we've been working on this it's for a bit, and she's still it's still tender right there. I can still see her reacting. So I'm actually going to put a cup there and see if we can get that to calm down. So I'm gonna pull this down a little bit. It's right there. Is that okay? Not too much? And then I'm just gonna let it sit there. I'm not even gonna do anything. We're just gonna get some blood flow, gonna work on some other areas for a minute, try to pull this IT band off as the cup is doing its magic, getting circulation going through there. And that feels a lot less ropey to me. Does that feel better? Okay. She said, oh yeah. Okay. We're gonna explore and see if we find anything else that's super tight, super tender. And there's a little bit right there, huh? Right there. So this is actually, the top of the hip comes right here, and you've got all these attachments for different muscles that attach where the top of the femur is. So I'm going to put a cup on the top of the femur, right there. If we wanted, we could also do an active motion where she brings her leg down and then brings it back up and down, brings it back up, and introducing motion with the cups is oftentimes really helpful. One last one, and relax. Is that better? Good. So that's calmed down. Her glute medius has calmed down. She had a lot of tenderness at the insertion of her hamstring on the ischial tuberosity, so let's put a cup there too. And so the hamstring, you're coming up, you come up, and then you stop when you get to the bone right there. So that's your butt bone where you feel when you sit down. That's the insertion of your hamstring. So we're going to put a cup right there. Let me see if I can find them. Yeah, that's the cord that I felt earlier. Is that suction okay? It's not too much? Okay. You'll see the redness of all the blood coming up into the tissues, and this will fade in 30 seconds. There isn't any bruising. There is a chance for some discoloration that lasts a day or two with the cups, but that's not going to leave a mark. You can already tell that it's getting lighter. So from there, we did some specific release on the hamstrings and the glutes and the IT band. Now we're going to use a little oil and have kind of a shotgun release to this whole section. Okay. Tickles a little bit. So I can tell that she's contracting a little bit, so what we're going to do first is we're just going to desensitize. So I'm doing this with no suction, and we just want her nervous system to calm down a little bit. Is that ticklish right there or tender? So this again there's no suction going. We're just trying to calm her nervous system down. A little suction again. That's tender right there through the IT band. So I've noticed in the past a bunch of comments about style of work and people experiencing tenderness. I've talked about this before. I don't mind if there's a little bit of tenderness. What my intent is not Swedish relaxation massage or one of the other styles that's more about relaxation. What we're actually doing is trying to identify the tender spots and get rid of them. And sometimes that's tender. So we're going to try that again in that area. Actually, this is the area that she was really reacting to. So rather than doing a bunch of work there, I'm just going to find the most tender spot. Tell me where the most tender spot is. Right there. So find the most tender spot. Just leave it there. Is that okay? Okay. And then we can just hang out, do some other work, let the cups do their thing. There, and she's not jumping. So that was 30 seconds of me just sitting here and the cup did the work for me. And she's not reacting down here either. So that was a high payoff. Alright, one more pass here. And let's have you bring your knee up to the side again like we were doing a little frog leg, and that way we can also get the edge of the quadriceps IT band connection. And that again is tender for, so we're going to desensitize. And I'm just going to set a cup down. Let it do its work. Is that less tender? Good. And then right in there too. Okay. So it's when I was moving the cup, I was finding some tender areas as I was gliding, even though I was having very little pressure or very little suction. But if you don't move the cup, it tends to be a lot more tolerable. So if there's a spot that was really really tender and you could see her like, oh, then come back, find out the most tender spot, set a cup down for 30 seconds and see what happens. And again, all this redness will quickly dissipate, but we're taking the tissue and lifting, we're bringing blood and nutrients into it, but we're also creating space between those different layers. So we're going to do that one more time. Oh, right there, a little lower. Okay, I see it. Actually, let's try this. I'm going to put it right to the side. Yeah. So that's right at the base of the IT band. A little intense for her. A tenderness there too. her peroneus longus is a little irritated too, kind of following that myofascial line. Let's take that off. Big breaths. All right, well that's a little tutorial on how to use massage and cupping together, both with and without oil. There are a bunch of different combinations, but let's get her down on the floor and see what we find. All right, well, we just finished treating the surrounding structures of the IT band, and we are going to check and see what's the result were. So let's go ahead and have you go to the right. Good. Still no problem, obviously. And let's try the other side. So she is not, her chin is not down to her knee, but she got probably 20 more degrees of motion when she first started. She was about to here, so she got a significant improvement in about 15 minutes. If she were my client, I would want to see her again and do the same treatment in 2 or 3 days, and have her assess, like, once you've done the general clearing, then you can start getting a better picture of what specifically is injured. But we've done the general release now. Like I said, in 2 or 3 days I'd want to see her again and have her tell me, oh, it's right here. It's, you know, because we found a couple of different spots that were real tender on her as we were exploring. All right, well, I hope you enjoyed this video. Thanks for watching. Don't forget to like and subscribe, and tell all those people out there that say I work too hard on people that they don't know what they're talking about. See you next time.